So in terms of getting your conscience out there, what do you do when there's no common ground? This I see as sort of like the climax of these tectonic forces coming toward each other. To violate your conscience is really to go against your deepest sense of your greatest good and to violate your own identity. That's crazy. But you're in a difficult position in a culture that has not taught us how to handle conflict. We're pretty conflict averse.
So disagreement between patients and providers happen all the time. So providers are in tough spot. So say there's a physician in their physician's office seeing patients, and the physicians, they have time, they have 20 minutes to see patients. So how much time the physician can give the patient talking about their concerns, talking about fears or thoughts, there is not enough time. And with that, patients may omit some kind of history they have, or they're afraid to say that something happened to them. So there's a problem there. There may be, there are too many barriers between the effective physician and patient communications.
And I think that's probably the hardest thing that any of us face is when the individual wants to refuse, to have treatment that the physician knows will only improve. However, it flips on the other side as well. All right, when the patients are demanding treatment, and again, we've touched on the issues of when they're demanding treatment that, from your own personal standpoint, from your conscience and ethical basis, do not feel that's something you can partake in. But the issues I see a little bit more frequently are realistically where family is demanding that everything be done. It's funny, it's rarely the patient that is doing that, but the families want everything done. And we understand that. They don't want to lose a loved one, but they're not looking out for the best interest of that individual.